So the first thing that we're gonna do when we come in to take bite wings is we're gonna make sure that the machine is on. And we're going to select T3. And then we're going to put our lead apron over our patient.
X-ray, like in the op or no?
All right, and then I'm gonna go ahead and sign in so that we can take our x-rays. To do this, we're gonna go up to Ascend and we're going to select our patient. And then we're going to go into the drop down under patient and click on imaging. After that, we're gonna go up to imaging and we're going to select acquire images. From there, we're going to say that we're going to do 4 bite wing images since that's what we're doing today. And you're gonna wanna make sure that your acquisition method is going to be the DEXIS Platinum. If not, you need to use the drop down and select the DEXIS Platinum. And then once we're with that, we're going to go ahead and proceed with the acquisition. You're gonna make sure that you have your cover on your sensor, and we're going to place it into our receptor with the cord coming out of the mouth, okay? We're gonna plug in our sensor. And then I like to just drape it over the chair. Remember that these are very expensive, so we wanna be careful with them when we're using them. It's gonna turn green, saying that it's ready to take the x-ray. We're gonna tell the patient what we're gonna do, and then we're going to go ahead and get our PPE on. You don't have to have glasses on when you're taking x-rays, but I always have my mask on, and you're going to make sure to wash your hands and glove up. How long do we wash for?
30 seconds.
At least 20 seconds. Making sure to get all areas of the hand and the wrist. We're drying them off. Make sure you get your hands completely dry so that it's easy to put gloves on. And then you're going to turn off the water with the paper towel. Make sure that before you start taking x-rays on the patients, you've removed any removable prosthetics. So if they have dentures, if they have partials, anything like that, you're gonna go ahead and take them out of the mouth before you take the x-rays. If you're taking x-rays on an edentulous patient for like new dentures or a new patient, if they have an opposing denture or partial, you can leave it in while you're taking the opposite arch. It'll just help you to where you have something to bite down on. And then just make sure that the one that you're taking is out.
What about piercings?
Piercings for PAs, it won't matter. If you're taking a piano or...
What if it's a tongue ring or a lip ring?
Still won't matter.
Won't matter.
No. If it's a lip ring, it might get in the way, but it should be out of the way when you put this in. All right, so bite wings is telling us first we're going to take the, I'm gonna drop this down so you can hear me, is telling us to take the right side. So I'm gonna go ahead and pull the lever down, which will allow our patient to open. And then I'm going to slide the bite wing receptor in, and you're going to place the mesial side of the receptor into the mesial tooth. So it says that we want 1, 2, 3, 32, 31, 30. So I'm gonna place the receptor right at the distal of the second bicuspid so that I know that all of the molars are going to be in it. And then you're going to just have them close down. And then you're going to push the ring all the way towards the patient. And we're ready to go. We're gonna bring our cone in. If you look at the cone, there's going to be, readjust this guy. If you look at the x-ray machine, there's going to be numbers. These are your degrees that we were talking about. So for a bite wing, you want to be plus 10. So it's going to be going down just a tiny bit to do that plus 10. And then you're just going to line up the cone to the receptor. So everything is going to be parallel. When it's parallel, you're going to go ahead and go out of the room. We're going to shut the door, and then just press that red button and hold it. Okay, go ahead and stop. And it's going to show us our bite wing. When you go to take your bicuspid shot, you really don't have to do a whole lot. You just have to pull it forward. You don't have to take the x-ray all the way out of the patient's mouth. You're just going to have them open. We're going to move forward. So again, our mesial area of the receptor is now going to be at our canine, okay? Because our mouth starts to curve in the front, we're going to curve our bite wing just slightly. So when we put it in our mouth, we're going to curve it to our canine and then have our patient close. We're going to bring in our cone. And then we're going to be ready. We're going to go out and we're going to repeat the process. Go ahead and press it again. And then open. And we have our bite wing shot. And then we're just going to repeat it for the other side. So we can have the patient open and we just flip our rin over. We don't have to redo it or anything, okay? I'm gonna snap these really quick.
For Dexter being all messed up and stuff.
Once we're done taking our bite wings, we're gonna take it out of the patient's mouth. We're going to take the plastic protector off. You're going to grab a cavicide wipe. And you're gonna wipe it down so that it's ready to go for the next patient. And then you're also gonna wipe down the lead apron and hang it back up. Okay, to view your x-rays, then we can just click on our full mount and all of our bite wings will then pop up so that we can analyze them.